My name is Pam. Today we're going to be talking about the incredible link between multiple sclerosis and Lyme disease. And I'm going to be sharing some really compelling research with you. I'm also going to share with you some nuggets that we've learned in helping our students recover from multiple sclerosis, and some of them, I'm sure, Lyme disease also. And also, we do have students that just work with us that are diagnosed with Lyme disease and they don't have multiple sclerosis. This is really important because this is one of the main infections that are causing multiple sclerosis. If we haven't met, my name is Pam Bartha, and I'm the author of Become a Wellness Champion and the founder of Live Disease Free. I was diagnosed with multiple sclerosis over 35 years ago now, and by the grace of God, I learned very early on that multiple sclerosis is an infectious disease. We didn't know all the different types of infections that were really common with MS back in the day when I was diagnosed, but boy, have we learned a lot. I've had not only the wonderful, amazing opportunity to live MS free for over 35 years, but I've had an amazing opportunity and a huge honor to support many wellness champions all over the world, helping them to recover from MS and other chronic diseases. And so what I'm going to share with you is our experiences with our students, what's working, what isn't working. And then you can take this information, you can work with your practitioner. You can also work with us if you don't have a practitioner. But this is really, really important because this is one of the main infections. So what is Lyme disease? Lyme disease is not just a single. Lyme disease is literally a collection of infections that travel together, and we get them through biting insects. So what I'd love for you guys to do is to make sure to share your questions, your comments, like are you diagnosed with MS? Have you ever been tested for Lyme disease? Can you relate to the symptoms that I'm going to be sharing with you? And then we'll definitely talk about how to recover. That's really important. And so we get these infections through biting insects. And it's not just ticks. A lot of us think that we get them only through ticks, but we do get them also through other biting insects. That could be mosquitoes. Mosquitoes are incredibly common. And so that would definitely be one of the insects that we're dealing with, but also there's spiders, there's different biting flies, etc. So it is going to be a number of different microbes that are involved. You may have heard of the bacteria that is called Borrelia, and that is kind of the main infection that a lot of doctors are trying to figure out if their patients have Borrelia. There's some different species of Borrelia, but there are others too. There's other microbes like Babesia and Bartonella and Ehrlichia. There's a number of them. There could be just under 10 or something like that. So today we'll talk about Borrelia, but we are going to talk about Babesia in the future also, because that is another really common parasite that's involved with multiple sclerosis. So Borrelia is a corkscrew-shaped bacteria. It looks like a little corkscrew. It's spiral, and it is a bacteria, so it's not like a fungi or virus or protozoa. It is a bacterium, and it's a sister. So it's not directly related to syphilis, but it is very similar. So syphilis is also a spiral-shaped bacteria, and they cause very similar symptoms, especially when they get into the central nervous system. And so there are many, many studies over the years that have linked multiple sclerosis to Lyme disease, because back in the early days, they knew that syphilis caused so many neurological symptoms that were common in multiple sclerosis. So the doctors back then thought, well, these poor people that have syphilis that moved into the central nervous system, they have all the same symptoms as MS, then MS must be caused by syphilis or a bacteria similar to the bacteria that causes syphilis. So that was really the start. And what's really interesting, I found that Pierre Marie is a researcher, and he proposed that MS was an infectious disease in 1884. So he was way ahead of his time. But from 1911 up until the 1950s, there were many, many studies that were published linking multiple sclerosis to this bacteria that looked like a corkscrew or a spirochete. And so I just wanted to share a few of these studies with you because they're incredibly relevant. And if you'd like to go deeper on these topics, then you can go to our website after livediseasefree.com. Under the main menu, under research, then you can look for MS as an infectious disease. And then you will be able to find the studies that are linking MS to Lyme disease, MS to spirochetes. There's a lot there. So we're talking about over 100 years of research. And you might be wondering, like, well, if there's that much research, then why are doctors not looking into this? We'll talk about that later. So I'm just going to talk about a few of the studies here because they're really, really relevant. They're fascinating. So in 1911, there was a researcher called Buzzard, and he thought, this is where it started, sort of, that he thought that MS is probably caused by a bacteria that's very similar to syphilis because of the common symptoms that people that have chronic syphilis and people that have multiple sclerosis share. And so what he did is he tried to inject animals with material from multiple sclerosis patients, but he was not successful in isolating those bacteria in the animals. So he would take, it didn't say in a study if it was blood or spinal fluid, but injecting it into animals, and then he was not able to find those in the animals. So then in 1917, Steiner and Kuhn, another two researchers, they found spirochetes. So they found these corkscrew-shaped bacteria in the brain and spinal fluid, in the spinal fluid of patients that died from multiple sclerosis. So these were confirmed cases of MS. They found it in the spinal cord and in the brain in the fluid. Interesting, 1917. And so they recovered spirochetes from the spinal fluid of MS patients by inoculating rabbits and guinea pigs with blood and spinal fluid from MS patients. So with microbiology, when they're trying to grow pathogens, sometimes it's difficult. Like these pathogens, they have very specific needs in order to grow them. And so you can't just assume you're going to grow them if you don't provide a good medium for them to grow on. You have to give them food, what they want. And so these researchers in 1917, they did discover spirochetes in the brain and spinal fluid. Then in 1925, so I'm not going to go over all the studies, but I'm just going to share with you like how significant this is. 1925, 3 researchers, Adams, Blacklock, and Mikulski, they found spirochetes while examining fluid obtained from the brains of monkeys and rabbits that were injected with spinal fluid from multiple sclerosis patients. The fluid was examined for several months after the inoculation when the animals developed signs of illness. The spirochetes that they found in those animals, they were identical to the ones that were described by the researcher I just mentioned, Steiner, in 1917. So again, a lot of times they will take fluid from MS patients and they'll inject it into animals and they'll see if they can grow the spirochetes that were discovered in the central nervous system of MS patients, and they were able to do that. So this is significant. This is in the central nervous system, right? Really significant. So in 1923, 2 researchers, Collins and Noguchi, they tried to grow the organisms by inoculating spinal fluids of multiple sclerosis patients into a specific medium. Maybe the researcher, he made a medium after his own name, so it's called Nochi medium. They were not able to get a positive result. So all attempts, they were trying to grow it on this specific medium, and all attempts failed. They were not able to grow these spirochetes. So when I looking back on these studies, like these spirochetes are finicky. They like specific growing conditions. And it's not just the medium, but it's also anaerobic. They don't want to be in a lot of oxygen. So they have to be in an anaerobic without oxygen and also a specific medium. Then in 1957, Simons is another researcher. He found spirochetes directly in the spinal fluid of MS patients. Like, isn't this enough already that we should really be looking at this? Like, this is multiple different researchers able to find these spirochetes in the central nervous system of MS patients. And they knew, all of these researchers, they knew that this bacteria was like a sister bacteria to the bacteria that causes syphilis. And they knew that if somebody had syphilis, they would have all of the MS symptoms. So they knew that this kind of bacteria can cause a lot of neurological problems. In 1957, Time magazine reported that a Philadelphia bacteriologist successfully cultured a microbe that looks like a spirochete from the spinal fluid of 78% of the MS patients that she studied. Almost 80% of the MS patients that she studied, they showed that they had the spirochete in the spinal fluid of the MS patients. She found no spirochetes, none in the healthy subjects that she tested. So in the central nervous system. So she believed that MS is caused by this spirochete, and early treatment should lead to an improvement or curing of this disease of MS. So she devised a medium culture. So that means that what you're growing the bacteria on, in which fluids from people that had multiple sclerosis were inoculated. And after 1 to 2 weeks of inoculation, a few spirochetes were found using dark field microscopy and phase contrast microscopy. So cultures from spinal fluids of healthy individuals and patients that had other neurological diseases were negative. So she did not find these spirochetes in people that were healthy or people that had other neurological diseases. Interesting. And remained sterile after 1 year of this inoculation. So even after 1 year, these people were still negative. They did not have the spirochete in their central nervous system. That's really, really huge. Whereas people that had MS, she was able to pick it up right away. So this spirochete is difficult to grow in the lab, and they do require specific medium, like whatever nutrients are put in the growing medium, but also the oxygen, it likes an anaerobic environment, so no oxygen. Some bacteria can't live in oxygen. In 1958, a follow-up study after that bacteriologist found almost 80% of the MS subjects she looked at, they showed the spirochete in their central nervous system. So this follow-up study in 1958, so a year later, they only found the spirochetes in 18.5% of the MS patients. So there can be lots of reasons why hers were higher and theirs were lower. It could have a lot to do with the technique they're using, the medium they're growing, like making sure the bacteria doesn't have oxygen. But still, they found these spirochetes in the MS patients still in almost 20% of the ones that they tested. So that's more confirmation again. And again, they found that all of the control subjects that they tested showed negative for these spirochetes. So there were no spirochetes in healthy people, but they found 18.5% of MS patients had these spirochetes in their central nervous system. So that's a lot. And these are not all the studies. These are just a few. Like, it's really hard to find this information because these are like 1911, 1917, these articles. So you probably have to be linked with universities and be able to pay for it and get all access to all of these studies. which is really unfortunate. It'd be really nice if they would make this readily available, because then we could all work together at finding the cure for multiple sclerosis and other diseases. So what's really significant is that with all of these studies, that they did not find spirochetes in the central nervous system of healthy subjects. Really, really important. Lyme spirochetes were discovered in the myelin sheath of brain nerve cells by Dr. Alan MacDonald, who is a very well-respected pathologist. So this is more recent. And so he found, I've shared this on my masterclass training, that he discovered for the first time ever, other than these researchers, they found, let's put it this way, they were able to grow the spirochetes. They did find them. So they did find parasites, but Dr. Alan MacDonald more recently is like the first pathologist to find small roundworms, but also to find developing tapeworms and larvae, the tapeworm larvae, in the central nervous system of MS at the time of their death. But he also found that these small roundworms were loaded with Borrelia, which is the bacteria, the corkscrew bacteria that causes Lyme disease. And so he also found Borrelia in MS patients in their central nervous system. So this was more confirmation also. And then in my masterclass training, I share all of his research. But what's interesting is that we're told that, your immune system is just attacking your nerve tissue for no apparent reason. But Dr. Alan MacDonald showed pictures of Borrelia, that spirochete bacteria, in the myelin sheath of patients that had Alzheimer's disease. So if these spirochetes can infect the myelin sheath of nerve cells in Alzheimer's patients, and we know that Borrelia is present in MS patients because he showed it, then do you think that Borrelia could infect the myelin sheath of MS patients when it's there? It's in the central nervous system, and it likes to do that. Maybe it likes to feed off of the myelin sheath. Absolutely. So maybe this whole theory that our immune system is attacking itself for no reason is false, is completely wrong. And maybe, as what's actual evidence is showing, that, like, just one example, if you have Borrelia in or near the myelin sheath, then of course the immune system is going to go after it. And of course that bacteria is going to cause damage to the myelin sheath. So between the actual bacteria causing damage and our immune system going after it, right, will cause inflammation and it will cause damage, and we will have problems with nerve damage. So it's not our immune system attacking our tissue for no reason. There is a big reason, a very, very big cause, and it is infection. So just keep this in perspective. I'm not saying that Borrelia is the cause of all MS symptoms. We know that with multiple sclerosis, we're dealing with dysbiosis. We're out of balance. It's kind of like if we had a weedy lawn, we don't just have dandelions, we have other weeds that move in too. So we have to treat a few different infections, but it looks like Borrelia is a really big, or a spirochete like Borrelia is a very, very big part of multiple sclerosis, according to the research from dating back to 1911. So syphilis, let's talk about syphilis for a minute. When people get syphilis and they are not treated well, then it moves from inside the body, it moves into the central nervous system. So there's really 3 different stages of the syphilis infection. There's primary, secondary, and tertiary. And the tertiary stage of syphilis is really when this bacteria that's similar to Borrelia, when it moves deep into our organs, into the central nervous system. And so some symptoms, we call it neurosyphilis then. Some symptoms of neurosyphilis would include severe headaches, muscle weakness and or trouble with muscle movements, spasticity, trouble focusing, confusion, personality changes, dementia, problems with memory, thinking, and decision making, changes in vision and blindness, hearing loss, tinnitus, dizziness or vertigo, paralysis. So these are just some of the symptoms of neurosyphilis, which is a bacteria like a sister bacteria to Borrelia. Doesn't that sound like a lot of MS symptoms? Absolutely. The Mayo Clinic website states, untreated Lyme disease can spread to other parts of the body for several months or years after initial infection, and it can cause arthritis and nervous system problems. Visit your doctor even if signs and symptoms disappear. The absence of symptoms does not mean the disease is gone. From the MS Society, this is a really big one. So they actually took this off their website. I don't know why. I found this a couple of years ago and it's not there anymore, but I did take a screenshot. You can use the Wayback Machine to go back in time on the web and you can find it, I'm sure. But I will be posting this image that I screenshotted from the MS Society. I'll be posting it on my blog post at the end of the week. So make sure that you go to livediseasefree.com and enter your name and email address so that you get our newsletters and also you know when I'm doing live events. If you feel that this information is important for you, which I would think it would be if you're dealing with any kind of neurological symptoms. So the National MS Society has said Lyme disease can cause delayed neurological symptoms similar to those seen in multiple sclerosis, such as weakness, blurred vision, and that can be caused by optic neuritis. Also, sensations of itching and burning and stabbing pain and pins and needles, confusion, cognitive dysfunction, and fatigue. Lyme disease symptoms may also have relapsing remitting course. In addition, Lyme disease occasionally produces other abnormalities that are similar to those seen in multiple sclerosis, including positive findings on the MRI images, and so also analysis of the spinal fluid that we would do with lumbar punctures. These similarities in symptoms and test results between multiple sclerosis and Lyme disease, that has led some people with MS to seek testing for the presence of antibodies to Borrelia, which is the spirochete bacteria that causes Lyme disease, to determine if their neurological symptoms are the result of Lyme disease or truly multiple sclerosis. The distinction is important because Lyme disease, especially when treated early, often responds to antibiotic therapy, whereas MS does not. And that is, I'm going to dispute that and show how false that statement is. Borrelia does respond to antibiotics, especially in the early stages of infection. Let me backtrack for a minute. We have found that when we have chronic disease and if we're dealing with bacteria like Borrelia, it's not so much in the blood. Antibiotics are not really helpful. We don't like antibiotics. If they would help us tremendously, we would say yes. If you were literally just bitten by a mosquito or a tick and you have an acute, very current infection of Borrelia, yes, then antibiotics can be helpful. But once we have neurological diseases like MS, then no, it's not helpful at all, antibiotics. So Borrelia can cause relapsing, remitting symptoms, just like MS I mentioned, and early blood invasion. So it will go into the blood, it'll move into different organs, and then the number of bacteria are going to be much less. So at the beginning, you'll have a lot more bacteria in your blood. And then when you have more of a chronic infection, it's moving more into the tissue. So that's why just treating the blood is not going to be helpful. Lyme disease can produce damage to blood vessels or the cardiovascular symptoms. It is very common with different spirochetal diseases. So we talk about Babesia, how that can really affect our vascular system, but also Lyme disease can also, so like Borrelia can. Infection doesn't necessarily lead to clinical illness, and infected person's immune system may contain it naturally. And this is the frustrating thing, is that you can have you can spend $1,000 on a DNA test, and number one, it usually gives a false negative. But then if you do get a positive test, like, is it that you still have antibodies, or you had a recent infection, but your body is handling it? And that's not what's causing most of your symptoms. Maybe it's flukes, intestinal flukes, or worms, or other bacteria. And so this is the problem with testing is, sure, just because they find a few antibodies and they might find some, antigens from Borrelia, does that mean that Borrelia is causing your strongest symptoms? Not necessarily, but we do know that Borrelia can cause a lot of neurological symptoms, so we definitely have to pay attention to that. We really like liposomal herbs. So there's blends of herbs that are emulsified in fat, so they will go deeper into the tissue. We really love the oxidizing agent that I talk about. I can't say the name of it here, but you can always go to Rumble or livediseasefree.com and find my video about using oxygen to treat parasites, and you'll learn about it there. It's really cost effective, really helpful. It's definitely a very important part of recovering from these types of infections. So we would prefer to use something like that oxidizing agent, plus also herbs, liposomal herbs, and plus the whole plan. Like, stop feeding the infection, support the body, feel a lot better, and then start treating. Really important. All right, so infection doesn't necessarily lead to clinical illness, and the infected person's immune system could naturally contain it. So, for example, my sister was tested years ago, and they did find some Bartonella and they found some Borrelia, but she's healthy. She doesn't have any disease. She has little things, like gut things that you treat once in a while, but she's a healthy person. She works out. So we're going to be exposed to these parasites like Borrelia through biting insects. Have you been bitten by a mosquito this year? So doctors that I really respect would be like Dr. Klinghardt is one of them. And he says that the vast majority, they wanted to go back to here, I think all of his MS patients, have tested positive for Borrelia. So that means that it's pretty common. But the thing is that probably all of us have been infected with Borrelia. Why is it that maybe 20% of us that are infected with Borrelia, we end up with chronic disease? And so what we find in our Lyme students is that if they have Lyme disease and they've been working with Lyme-later doctors and they've been using antibiotics and they're still really sick, they backtrack and they start treating the bigger parasites, and they're like, oh my gosh, I can't believe how good I feel. And they're passing like really big worms. Like, some of them are over 2 feet long. So sometimes we think it's only Borrelia, but there's other parasites involved. And we have to treat the large ones, because even Dr. Al McDonald showed that the small filarial worms, they could be the size of the dot of a pen. They're loaded with Borrelia. Borrelia is the bacteria that causes Lyme disease, that corkscrew bacteria that's been linked to MS for many years. So they can carry Borrelia into the central nervous system. And then when these worms die, they release all of their parasites, their Borrelia and others. And then we end up with a buildup of these infections in our central nervous system. So oral antibiotics, they really don't work if you're dealing with a chronic Lyme infection. Some doctors will do IV, but I literally spoke to a beautiful lady today. My heart goes out to the people that I work with. Like, they have suffered so much. She has worked with Lyme-later doctors. She's been on antibiotics, like even IV antibiotics, and she's still getting worse and worse and worse. And she's scared. And she was a healthy, like people say, I was a healthy person. I was an active person. I never in a million years thought this would ever happen to me. And so that's not the answer. We haven't found, and trust me, if you have like an acute bladder infection, yes, use antibiotics. If you have an acute dental infection, yes, deal with it, get over it. But for these chronic infections, we have not found at this point in time that antibiotics are very helpful, whether it's IV or oral antibiotics. All right, so I went through all of that. So The spirochete can invade the central nervous system very quickly, the one that causes Lyme disease. And so it can cause meningitis, it can cause optic neuritis, and that's really common with MS, inflammation in the brain, inflammation in the spine, facial nerve palsy. That's actually a really common symptom in the United States, especially. And what's really interesting too is when you look at MS, you see that there are more attacks at certain times of the year. And also, the different biting insects are definitely present at certain times of the year, and they link with MS too. So that's another really big clue. Make sure to check out our blog post. And the blog post is Does Antibiotic Therapy Help Multiple Sclerosis? So I'm not advocating antibiotic use for MS, but remember the MS Society said antibiotics don't help MS patients. Well, there's a 2017 study where they investigated if the antibiotic minocycline could help reduce the risk of converting the first MS attack, which we call clinically isolated syndrome, to full-on multiple sclerosis, like relapsing, remitting, or progressive. So like when we have the first attack, if we give people antibiotics, can that decrease the number of people that would actually go on to having multiple sclerosis for a lifelong diagnosis? Interestingly, this study was supported by the MS Society of Canada, and their conclusions were that this trial showed that the risk of conversion from clinically isolated syndrome to multiple sclerosis at 6 months was significantly lower in minocycline treated group than with the placebo. And all MRI outcomes at 6 months favored the use of minocycline. So if you have chronic MS, I'm not saying minocycline is helpful, but if you are just having that first MS attack, they're saying that yes, significantly in that study, there was a significant reduction in people that moved on to having relapsing, remitting, or progressive multiple sclerosis. This study showed a significant decrease in the progression of multiple sclerosis, especially in the first 6 months. And it's strange that this study was supported by the MS Society, and yet they state on their website that antibiotic use does not help multiple sclerosis. In 4 clinical trials, the use of minocycline resulted in less lesions, less relapses, less inflammation, smaller lesion sizes, similar side effects with less disease severity, again in the first 6 months of the study, but not at 24 months of study. So that makes sense, because if Borrelia is involved, it moves into the tissues, it moves into organs, it moves into the central nervous system pretty quickly, and then this antibiotic is really not going to be helpful. So that is a lot of research dating back to 1911, and also showing that they're finding these spirochetes in the central nervous system, in the spinal fluid. They're actually able to take the spinal fluid from MS patients, put it in animals, and they're able to find those animals get sick, and they're able to harvest the spirochetes out of the animals. And they're just also finding them in the spinal fluid. But they're not finding them in healthy people or people that have other neurological diseases. Crazy. So I wonder why the MS Society took that off their website. It just makes me really wonder. And I also really wonder why we are not studying this. Why is the panel of experts that have put together the McDonald criteria of how we diagnose and treat multiple sclerosis around the world, why are they not interested in this? Why are they not pursuing this? Why are they not proving this to be wrong, right? Why are they stuck on MRI, looking for lesions and looking for antibody bands with lumbar punctures? And they're like, we don't care how they get there. All we care about is if you have a lesion, or if you have a backup with MRIs, looking for antibody bands, you have MS. We don't care what causes it. We think that the immune system is attacking itself for no reason, but who cares? We've got drugs for you. We have drugs for you that will not stop the progression, that will not give you your life back. They're not even talking about cures anymore. Like, it's time for us to get mad, like respectfully not happy. And I mean respectful, like not violent or anything like that, but to start questioning them. And they aren't going to like it and they're going to be uncomfortable. To show them this research, to say, did you know, Mr. Neurologist, that, or Mrs. Neurologist, there's all this research where they found spirochetes in MS patients, but not in healthy subjects. Why are we not studying this? Do you know that neurosyphilis causes all the symptoms of MS? Like, do you know that? And they found these spirochetes in MS. Like, why are we not studying this? Why has this not been disproven? Right? And just know that a lot of our healthcare professionals are getting kickbacks on prescribing these MS drugs. So we are gridlocked right now. We're in this situation where we cannot get the care that we deserve. We cannot look for the specific infections that are causing MS because they're not interested. And until enough of the population moves away from this disease management approach and they start taking responsibility for their own health, we're going to continue with this. Like, as long as we're the guinea pigs that keep going for the stem cell transplants and going for all of these, immunosuppressive chemotherapy drugs. And that's another thing I wanted to say too, that the stem cell transplant uses chemotherapy drugs to destroy our immune system. And then they bring it back to life again. It's not just hurting the immune system. It's an incredibly toxic drug. It affects, just read up on it. You'll see the adverse effects. And one of the adverse effects is increased risk of cancer. I was just speaking to somebody today who, sure, like sometimes we can have some small symptom improvements when we use these chemo drugs. Absolutely. But chemo drug, if you look at chemotherapy or chemo, you'll see the definition is that it kills viruses, bacteria, other microbes. So it's not just a chemo drug, actually, by definition, is not just, we're just going to kill your immune system. So when you take a chemo drug, it's definitely destroying your immune system, but it also hits the microbes, the Borrelia, the Babesia, and some of the microbes that are causing MS. So it's knocking them back. It's not the most effective treatment, but it makes sense that if it's toxic to those parasites, that you are going to have some symptom relief for a little while. And then in 6 months to a year, you're going to notice, just like this one person I was talking to today, he started getting a lot of nerve pain, but he's still disabled. And the way they measure the success of the stem cell transplant is like, if you get like less than 1% improvement in your EDSS score, and you're able to maintain the lesions for 6 months or a year or something like that, you are successful. And it's like, but you still have your drop foot, you still have spasticity, you still have fatigue, you still have a foggy head. You might have had some slight improvements. That's exciting. But what if you could use a treatment that actually targeted the cause more effectively, that wasn't so hard on your immune system, that didn't hurt your immune system, that just focused on targeting the parasites in a more effective way, and then you could recover and you can just live your life, and you can actually have not just like a 1% or less than 1% improvement in your MS score, but what if you don't need to see a neurologist anymore? What if you are able to start working again, start driving again, start playing with your grandkids, all of these things? If you haven't listened to the successes of our students, make sure to do that. You'll find them on our playlist on Live Disease Free. You'll find them on our website. They're so miraculous, and it's so frustrating because this is the answer. This is the direction we need to go. And it's not just Borrelia, it's not just Lyme disease, but this is one of the very big causes of MS. So it's a few different infections, but from our experience working with hundreds and hundreds of students all over the world, that yes, Borrelia is very common, but we don't spend a lot of money on expensive tests. We don't use antibiotics. Our students first treat the big parasites so that they're feeling so much better. Then they can treat these smaller parasites easier, and your immune system has less stress on it. Your immune system is helping more. We need our immune system. It's there to defend us from infections. It's just that it needs help. It does not need us to destroy it. Really important. Your immune system is what keeps you alive. All right, I'm going to go to your questions. Hello, angel baby. Correct. But as far as I'm concerned, the popular disease modifying drugs being prescribed are nothing more than handing a restaurant patron a fly swatter instead of closing the door and spraying with insect repellent. Yes, obvious, but it's just it's a lot more painful than flies, right? That's the problem, is like people are losing their life. They're suffering so terribly, needlessly. So happily, because I enjoy doing research and have MS, I've covered more ground faster, and I can test and monitor my results to date. So make sure you focus on treating infections and you will recover. So Shalena, the YouTube work is not working. Some people are on it right now. I'm seeing YouTube buttons. And so I am satisfied. So she's using a tincture that's working right now. That's great. So you are starting to use. So your body will repair the myelin. But just please be aware that it's not just Borrelia, right? That it is the larger parasites. And if we come to a place where I can just share that there's only herbs that are necessary, but we have honestly found that the larger parasites, they do need to be treated with the parasite drugs. It's shocking what's coming out of people. And yes, antihistamines are very helpful for multiple sclerosis. They definitely are. But it's not, it doesn't do any myelin repair. What it does is it sedates us so we can sleep, because a lot of us have sleep issues, but it also sedates the parasites. And so that's what it is. So it's just helping to decrease inflammation, but you still have to treat the parasites effectively. So with your tincture, if you get to a place where you plateau and you're not able to have any more symptom improvements, then you need to change up your protocol and incorporate other types of treatments. And so we normally don't recommend using the antihistamines during the day and night. Our students will just use them if they tolerate them. They'll use like a regular strength Benadryl at night, and it helps them to sleep. So we would not, like, antihistamines are not something you should take long ongoing, and it's not going to cure MS for sure. But it can be helpful to, again, help to break the insomnia that a lot of us have, having a difficulty sleeping because we're very sleep deprived, and then we're not going to heal. And also it will sedate the parasites while it's sedating us a little bit. All right. And hi, Ahmed. Can you talk about how to use, no, I can't talk about any drugs online, how to use it. So, but I can talk about the drug in general. So hydroxychloroquine is a drug that treats malaria. It's also used to, and I would say that it's not a super effective drug for curing malaria, but it is very helpful. It's also used for people that have lupus and arthritis, and it does have adverse effects. So you really have to work with somebody when you're using it. It's not a treatment of choice for us because it's not going to cure the spirochetes. I mean, if we're energy tested with it and we test really positive for it, then yes, it's going to give us an indication that we probably have a malaria babesia type protist, or that we need to parasite that we need to treat. But there are many other treatments that would be more effective. I know that there is a newer drug, tafenoquine. It's harder to get in certain countries. We can't even get it in Canada. It's called tafenoquine. But again, if you don't do all the prep work first, if a person doesn't do all the prep work, then it's very difficult to clear even things like malaria, babesia, etc. So hydroxychloroquine, it might give you some symptom improvement. If you're using the right amount, you've got to keep checking with your doctor. They need to check your retina. It can affect your retina. And then I wouldn't just use it alone. I would be using it with other things. But I would first we have a protocol in the Live Disease Free Academy where it's I almost said the name, but it's the oxidizing agent plus wormwood plus ozonated myrrh. So it's a little bit more of a stronger myrrh. Myrrh is anti-babesia, but the ozonated myrrh would be even more helpful. And then, a person could add in the drug you're talking about if you're working with somebody, but I would be careful with that because you need to have your vision monitored. And it by itself is not going to cure you. Yes, unfortunately, Frida, follow the money. It's really awful. Yeah, so hydroxychloroquine is derived from quinine, and back in the late 1800s, early 1900s, there were several researchers that were treating MS patients with quinine and having incredible success. And yeah, there are tincture forms that you can find. I just don't know. Again, it's not a cure. Like even when they're giving it to MS patients, to lupus, they use it for lupus and arthritis, and those patients have to use it forever. It kind of manages the disease, but it does not treat the parasite well enough. Awesome. You're back to your old self. I'm so happy to hear that. Hi, Robin. A couple more questions. You're so incredibly welcome, Robin. So let's see here. Hi, James. Thank you for all your kind words. Really appreciate it. What you can do is you can help me by sharing this, right? I just shared a lot of research, like a lot of really significant research. I also gave people talking points on how to challenge their healthcare professionals. And yeah, maybe some of them aren't going to be too happy, but who cares? Like, you do it respectfully, but just put it in their face. And if one person says something and then another and another and another, and they keep getting bombarded with all this information daily from their patients, it's crazy. We have students all over the world that are going to see their doctors and their practitioners, and they're like, have you heard about this? Have you heard about this? And so there's going to come a point in time, if they're a really caring doctor, that they're going to start looking into it. And there is going to come a point in time when our healthcare system is going to change. It's going to take time, unfortunately, because there's multi-trillion dollars involved. And this is not just MS, it's cancer, it's every autoimmune disease, it's heart disease. Like, this whole healthcare industry has become absolutely crazy. And there will come a time when things are going to simplify, and we're going to maybe just need one doctor. We aren't going to need all these specialists, because if they treat parasites early, you don't need all of these different specialists. Maybe a couple of them, but not like we are right now. All right, I'm going to just answer a couple more questions here. Yes, I know of the study about clustamine, and look at my blog post. So you'll see. So what happens with an antihistamine is, if it's decreasing inflammation, right? When inflammation is decreased enough, then your immune system just starts to go to work to healing, right? And so it's not that the antihistamine healed myelin, it's that the antihistamine helped to reduce the inflammation, and then the immune system, the body just heals itself always. So whether you take like the antihistamine or not, if you treat the infections, the myelin will heal. Whatever is just inflammation will heal. And that is because the inflammation is gone, the body heals itself. So that drug, the antihistamine, is not healing MS, just so you know. You can read the article on it. And that's the problem with a lot of these studies, is that they're really confusing unless you have a little bit of a science background, which I do. I'm so sorry to hear that, James, that your wife battled with MS for 24 years. She passed at home. I am so sorry. Before she could have benefited from treating these infections. This is why we do this work. It's just absolutely brutal. So yes, that is incorrect. The antihistamine does not repair. They say that because they want to sell it for that purpose, but no. It's not like we need antihistamines to cure ourselves from MS, but sometimes some things can help to decrease inflammation, and then our body always wants to heal itself. You're very welcome. Okay, I'm going to let you guys go. So if you are new to all of this, make sure to check out our blog posts on livediseasefree.com. Those are articles that I write, and you'll see there's the shortened versions of these videos, plus the articles, so you can either scan my notes. And please share those blog posts with different practitioners, with different MS groups. Start talking about this research, right? And again, this is like coming from the MS Society. So like, duh, and they took it off their website. They're heavily funded by the pharmaceutical companies too, so they probably were told to take that off. I don't know. I'm just guessing. That's just my speculation, but why else would you take that off? Was their information inaccurate? I don't think so. It was up there for a long time. Why did they take it down? You can find it in the Wayback Machine. So learn about this. And when you get to the place where you really know in your heart that you are dealing with a parasitic infestation, whether it's MS, whether it's a different disease, and if you don't have support of a practitioner and you want to really learn how to play an active role in your healthcare, how to recover from disease in the most cost-effective way where you're doing most of the work, it's not hard, but it's just so cost effective and you get the best results, then make sure to watch my masterclass training where I share all the steps in the Live Disease Free plan of how we are recovering from these parasitic infestations that are causing disease. And then once you do that, if you want support, then you can book a time to chat with me. You can join, you can become a wellness champion. We are getting to the end, not total end, but we are getting close to the end of 2024. And you have to decide, what do you want 2025 to be like for you? Do you want more of the same? Or are you at a place where you're like, I want different. I want 2025 to be the best year that I've ever had in many, many years. If that is the case, you have to take a different path. You have to start going through this information I share, just a little bit here and a little bit there, and get that belief system going up. And then if you don't have a practitioner that can help you, or if you don't want to spend a lot of money on your recovery, then make sure to reach out to us, because honestly, this plan is the most cost-effective way to recover, and we would be honored to support you. And then you can have this next year, which I highly recommend because of all the insanity of what's going on in the world. You need your health, you need your strength. But more importantly, you need to enjoy your life. You need to be doing the things you love to do. So with that, please like, share, and subscribe if you found this information helpful to help us get the word out. And we will talk to you next week. Take care and bye for now.